Okay, well, looks like a few folks are joining. I think we can start. Welcome again, everyone, for coming today. Thank you for being here. Thank you for joining us. Kara, why don't you go ahead and get us going?
Yeah, definitely. I apologize in the delay of me getting these links to you in the chat, but I will be sharing some upcoming events, and I will also put the sign-in link to sign in for the seminar in the chat after our introduction. But feel free right now if you would like to introduce yourself in the chat, name, location, if you're a new or returning participant. We love to hear from you. So today we will be hearing from a few of our InStep Center pilot awardees, Rachel Schuck, Christina Yuan, and Rheanna Platt. Will all be sharing some updates from their pilot projects. I do want to let you know that after today's seminar, we will be going on summer break. So we will be taking a break from July until September. So we will be back to our regularly scheduled programming September 18th with the second iteration of our InStep pilot awardee presentation. October, we have a really great panel where we are going to hear from folks who are actually working outside of academia and kind of how they are doing in their D&I careers outside of academia. We'll have our November topic shortly, and we'll be sending out a notification for that presentation. And then our December seminar will be the DIS D&I Research Intern Showcase. It's really nice to hear from students who are kind of early in the field and seeing kind of where they are and hearing about their future goals. You are able to register for any of these events at the registration link at the bottom, but since you're in this one, you should be able to join all of the other seminars for 2025. We will be having EPIS office hours. So July 8th, we will be hosting the EPIS office hours at 2 sessions. So session 1 is from 8 to 9, and session 2 is from 4 to 5. This is a really great opportunity to meet other EPIS users, to ask questions about the framework, hear from the developers, and really discuss the application of EPIS in your work. Next, I wanted to let you know that there is a funding opportunity through the InStep Center. So this is another round of pilot awards looking to support pilot feasibility studies to address cross-cutting gaps and critical targets in community systems caring for children with mental health concerns. I will put the information in the chat if you want to learn more or apply. Next is our D&I Models in Health web tool. So the D&I Models in Health web tool is an interactive online resource that helps researchers and practitioners apply D&I theories, models, and frameworks. We just completed the new assess section, and we are looking to expand it. So if you can, we are looking for anyone to submit quantitative, qualitative, and mixed methods instruments. These are tools that are used in implementation research and practice. If you don't have any instruments to submit, we also ask that you take some time to rate the existing instruments and D&I theories, models, and frameworks on the website. I'll put all of these links in the chat, so don't worry. And now I will hand it over to Marissa.
Yeah, thank you, Kara. So as Kara mentioned, the InStep Center recently opened an RFA, request for applications, wherein we intend to fund a few pilot projects that address team effectiveness in different service settings. And as Kara mentioned, there are going to be links popped into the chat where you can learn more about these different opportunities, and you can access the RFA. But today we have 2 projects from a previously awarded round of InStep pilot funds. Two projects are being presented today. One is led by Dr. Rachel Schuck, and I'm going to keep the intros a bit brief since we have two projects to talk about today. I want to make sure we have time for our presenters to actually speak. But in any case, these projects are great examples of pilots that can be funded through the InStep Center. So hopefully as you watch and you listen to these projects, maybe some questions come up about whether you have a project that could be funded. We can talk about that at the end of today's seminar. In any case, we'll have one project that's going to be presented by Dr. Rachel Schuck. Dr. Schuck is a postdoc in the Department of Psychiatry and Behavioral Sciences at Stanford University, and she was previously a postdoc at SDSU and worked at our Child and Adolescent Services Research Center, if I'm not mistaken, with Dr. Mary Baker Erickson, who I think is joining us today as well. And her research interests really center on improving support services for autistic individuals and really aims to promote understanding of neurodiversity among helping professionals and the general population. So really excited to hear how your project has been progressing, Rachel. And then we'll have another presentation by Dr. Christina Yuan and Rheanna Platt. Dr. Christina Yuan is an associate research professor in the Department of Health Policy and Management at Johns Hopkins Bloomberg School of Public Health. She's principal faculty at Johns Hopkins Armstrong Institute for Patient Safety and Quality and the associate director of the NIMH P50 Johns Hopkins Alacrity Center for Health and Longevity in Mental Illness. And Dr. Rheanna Platt is a clinician scientist and associate professor of psychiatry and behavioral sciences at the Johns Hopkins University School of Medicine, and has a joint appointment at the Johns Hopkins Bloomberg School of Public Health and the Departments of Mental Health and Population, Family, and Reproductive Health. Both doctors Yuan and Platt are do dissemination and implementation research. Dr. Platt was a 2021-2023 Implementation Research Institute Fellow. So also very excited to hear how your pilot project has been progressing. So I believe we can, if I'm not mistaken, I think Dr. Schuck is presenting first. Why don't you take it away?
All right, thanks, Marissa. I am going to share my screen. All right. Are you, let's see, seeing what, just the full screen?
We see your presenter view.
Oh, okay, let's see.
That looks good.
Oh, okay, great. All right. All right, so thank you so much. My name is Rachel Schuck. As Marissa mentioned, I'm a postdoc at Stanford in the Department of Psychiatry. I am going to be talking about a project that got funded when I was a postdoc at SDSU, along with Dr. Mary Baker Erickson. And my presentation today is titled Exploring Team Effectiveness Factors in Transition Planning for Autistic Youth. So before getting into the details of the project, I just want to mention that a little bit about the team. So in addition to myself, the InStep Center funded Dr. Mary Baker Erickson and I to do this project. And then currently we also have a wonderful SDSU undergrad who's helping out as a research assistant. So thank you to Janai. She's not here, but her help is really, really amazing at this point. So this whole presentation is going to be talking about transition planning for autistic youth. And so in pre-K through 12 education, there's multiple different transitions that could occur. But I'm going to be talking about the post-secondary transition. So the transition between high school or the end of K-12 education and whatever comes after that. So it could be college, could be employment, could be some other kind of service or program. Whatever it is for each individual student, that's the transition that we'll be talking about. So IDEA, the Individuals with Disabilities Education Act, mandates that each student with a disability who receives special education services has an individualized transition plan in place as part of their IEP or individualized education program by the time students are 16. So that's, even in this one little sentence, a lot of jargon, a lot of acronyms, but basically this means that once a student in special education services turns 16, they're supposed to have this transition plan in their education program. And this transition time is really important for all students, not just students with disabilities, but it can be especially important to really plan for students with disabilities, and it's really crucial for autistic students. So if we think then about this being a period of time where adolescents or sort of becoming adults, if we think about autistic adults, we're seeing that autistic adults are underemployed or unemployed at higher rates than neurotypical individuals, certainly, but also higher than other disability groups. They're paid disproportionately less when they are employed. The utilization of college disability services is drastically different from K through 12 special ed. So in K through 12, if an individual is identified as having a disability and needing additional supports, that's mandated to be provided by the school. And there's, as I'm going to be talking about, a whole team that's dedicated to assessing that and providing those services. Whereas if an individual is enrolled in college, it's up to them usually to seek out the disability office on campus, provide documentation of a diagnosis, and get that accommodations process rolling on their own. There's also some research has shown that college graduation rates differ between autistic students and other disability groups. Some shows that it's not, like, for example, there was a large study in the Netherlands a few years ago that showed that there wasn't a huge difference between rates of college graduation amongst autistic students and students with other disabilities. However, the experience of college is still going to be a lot different for autistic students. And there was another recent study that showed a link between feeling like the transition experience was difficult and dropping out of college. So again, something to be really preparing for is this period of transition. And a lot of autistic adults have indicated that autonomy and self-determination are really important topics. And so again, this period of like transitioning to adulthood out of school is a really important time to be thinking about those aspects. So I want to just show you briefly what a transition plan might look like for those of you who have never seen one, just so you have an idea of sort of what we're talking about here. This is just one example. This could look different in different districts. This is from the California Transition Alliance. They have a little manual about transition planning. So the main thing to be looking at here is in the middle, there's these three boxes where goals would go. So this transition plan has a section for a training or an education goal, an employment goal, and an independent living goal. If you're familiar with an IEP, an individualized education program, which kids have throughout their schooling, an IEP has a lot of different goals that are focused, that one focuses on during a particular school year. But the transition plan typically has just a few goals that are really more targeted to these areas. And you would indicate who's sort of in charge of helping support that this goal and what sort of activities the student would be engaged in trying to meet these goals. So then the next question would be, okay, well, who is responsible for planning this transition? So throughout the rest of this presentation, I'm going to be talking about this transition team. And so some schools use this term transition team, some schools use other terms, but that's the term that I'll be using. And a lot of these folks are actually very similar or the exact same people who would be on just a typical IEP team. So the student is an integral part of the team. Oftentimes, especially in transition age, invited to actively participate in transition planning. Family members are also part of this team. So parents can also invite other folks, probably most likely an advocate, school personnel like special ed and general ed teachers, representatives from the administration. If the school has a transition specialist, they would be a part of the team, and a school counselor or psychologist. And then what's unique about this transition period is that it also could include folks from the community, most likely vocational rehabilitation counselors or representatives from a regional center if you're in California, or perhaps the Department of Rehabilitation. Because part of the focus of transition planning would be to help students after high school if they're going to be getting a job or they need to prepare and build skills for a job. It would be helpful to have folks from those kinds of agencies on the transition team. So these teams just sort of exist out there in the community, in the wild, so to say. And it's not that people are like applying for a job to be on this transition team per se. It's just that if you have these roles, you are going to be a part of this team. And we know from prior research that these teams for autistic students don't always work together super smoothly. So the process can be hindered by ineffective communication amongst team members. It can sometimes be unclear who's responsible for which action item. For example, parents might feel like, what am I really supposed to be doing here? Am I supposed to be coming up with the goals or just approving the goals? Sometimes these collaborative community relationships are lacking. So again, it can be really important for students to get that hands-on experience out in at a job site. But if the school doesn't have that kind of relationship with any sort of community organizations, that just wouldn't be possible. Some professionals also lack comprehensive understanding of autism, and that can create problems if folks aren't familiar with characteristics of autism and have never worked with an autistic person before. There can sometimes also be tension between academics and life skills. So is the focus on just getting the diploma and getting the grades, or should we be teaching life skills and vocational skills as well? And this is a quote from one of the studies looking into this. Participants commonly described the post-secondary systems like the Department of Vocational Rehabilitation and the Department of Developmental Services as rigid, disconnected, and a fractured system where no one talks to each other. So again, an example of ineffective communication, not just between individual team members, but also more at a system level as well. So then we know that these teams sometimes can have struggles. So then we were thinking, how can we think about the success of transition planning from a team effectiveness point of view? So our project then has three main objectives. The first is to understand what transition teams are doing well and what kind of needs improvement. Two, explore how transition team members perceive outcomes, like how acceptable do they feel that these transition services and the transition planning is? And then three, identify strategies that transition team members feel might improve team effectiveness. So we're doing this through two studies. So first, and the first one we've already completed this first portion, which was an analysis of pre-existing survey data from transition professionals like teachers and administrators. And then we used the findings from that survey to inform qualitative interviews with transition team members, so autistic students, caregivers, and professionals. So I'm going to tell you a little bit about both of these portions of the study. So this first one, the transition professional survey, which Dr. Baker Erickson and some other colleagues had collected a few years ago. This was an online survey where 42 professionals, mostly special ed teachers in over 10 schools in San Diego County, participated. They answered some multiple choice questions about their school and district programming for transition, barriers to successful transition programming for autistic students, and also things like the biggest challenges, their use of evidence-based practices. And we do currently have a manuscript under review regarding this study. And I'll just share with you a couple of the findings. But before sharing that, I just want to highlight that we did use the EPIS framework, the Exploration, Preparation, Implementation, Sustainment framework, the implementation science when analyzing this data and really thinking about the outer context of things like policy and connections with community organizations, students and family characteristics, which are seen as part of the outer context because they're not really part of the school, versus then the actual school itself, so school leadership, professional development, the teacher training. And then we identified as a bridging factor the fact that the survey was developed in collaboration with Achieve, which was Dr. Baker Erickson's community partnership. So community members had helped out in the development of the survey. So I just want to highlight here, this is a figure from the paper highlighting potential different barriers to successful transition planning. So participants could indicate the degree to which they agreed or disagreed that this was a barrier to successful transition planning. So the black means they mostly agree, and then the slightly dark gray means that they slightly agree. So those darker colors mean that yes, this was a barrier, and you can kind of just see without reading too much that there's a lot of barriers here, a lot of endorsement of barriers. And some of the most frequently endorsed barriers were things at the individual student level. So things like attention difficulties or rigidity and flexibility, troubles with interpersonal skills. And so these are seen as part of the outer context of the transition planning, because again, even though kids go to school, they are coming from outside of the school and like bringing themselves into the school. Interestingly, some of the things in the inner context were endorsed less frequently. So we see less darkness around this area, things like lack of evidence-based curriculum or minimal school-home communication. So there's definitely endorsement of those barriers, but definitely less so than some of these other ones, particularly at the level of the individual student.
Okay, so we all love.
And when asked about the biggest challenges that professionals were facing, they highlighted lack of resources, particularly for folks in rural communities, the burden on teachers to really set up partnerships with the community. Folks highlighted the issue of too much focus on academics for diploma-bound students. And then also a few professionals brought up student and family issues. So for example, unrealistic family expectations. And then also interestingly, the interplay between students' autistic traits and an unsupportive environment. So from the prior slide, you saw that there was a lot of endorsement of barriers at the student level, but some folks were really highlighting that this was really a barrier because there were unsupportive, non-inclusive environments where folks didn't know how to work with individuals on the spectrum. And so we used these findings to help develop qualitative interview guides for the second portion of the study. And this portion is in progress. So we're aiming to recruit and interview 30 transition team members. So autistic students, caregivers, and professionals. And professionals are eligible to participate as long as they are actively participating as an IEP team member or transition team member for autistic students. So administrators, teachers, it could also be other service personnel like speech or occupational therapists or transition specialists. The interviews are conducted on Zoom. All participants do receive a gift card for participating. And in addition to using the survey findings to create the protocol, we've also looked at different constructs in team effectiveness to make sure that we were capturing data around those constructs as well. And we have not gotten to this part yet, but we are planning to use thematic analysis to analyze the the interview data. And once we do that, we're also planning to do a member check where we show our findings to some of the participants for their feedback. So I'm going to just show you a couple excerpts from some of the interviews. This is not findings. We have not done any thematic analysis, but I wanted to just pull out some quotes that were related to some of these team effectiveness constructs that we were hoping to target. And so some of the constructs that we did ask about were things like team member roles and responsibilities, communication, team cohesion and conflict, and building partnerships with outside organizations. So we have done 19 interviews so far, mostly with caregivers. We're still doing them, and transcripts are currently being reviewed for accuracy. So thank you, Janai, our research assistant, for that. And here's some of the quotes from the professionals. So two of these quotes here are about, the one sort of at the top and on the right of the screen on the bottom, are about including students in transition planning. One teacher talked about how they're having students do an all about me PowerPoint and presenting that at the meeting, and that's sort of hit or miss. Another professional mentioned how they usually have these meetings at times when students can't really come. And so that was a potential issue in thinking about team member role and responsibilities, because the student is an integral part of the team. And communication also came up too. Like a teacher was talking about having the opportunity to have informal lunch with other team members, so you could sort of have opportunities to chat outside of formal channels of communication. The two quotes here at the top are from students who were talking about how team members were really helping them identify their strengths and what sort of programming would be helpful for them in the future, and creating this aspect of person-centered and student-centered planning. And then bottom, who's our IT team sort of thought about it. And then finally, the parents, a lot of the parents were talking about issues with communication. So either not really knowing what transition was, or realizing that transition should have been in the IEP, but it wasn't. But on the other hand, some parents talked about, hey, you know, I'm in constant communication with my son's transition team via text, and it's going great. So these are all things that we're hoping to really dive into in our next steps, because we're still recruiting participants, but we are going to start doing some preliminary data analysis in the next couple weeks. So we're hoping to really finalize our coding scheme and dig more into these interviews, because there's definitely a lot there. So I've got some references, and I just want to thank InStep, both, of course, for the funding to complete this project, but also for the amazing consultation we've received throughout this process, everyone who participated in the research studies, the Achieve community partners, and our prior SDSU research assistants. And thank you all for listening. I'm happy to answer any questions if anyone has any.
Thank you, Rachel. That's so fantastic. You've progressed a ton on this project. You have done so much work since receiving funding. It's amazing. I'm thinking about time. I'm thinking about questions. And I'm wondering if it makes sense for us to transition to the next presentation and hold questions either to chat or to the very end of both presentations. Does that work for everyone?
Works for me. Thank you.
I love that figure, by the way, of barriers and then organized by inner and outer context and different factors. I'm gonna steal that.
Thank you.
And please, if folks do have questions about Rachel's work, please feel free to pop it in the chat. And then again, as mentioned, I hope to have time at the end so that we can talk through some of these.
Should I jump right in?
Yeah, go ahead. Thank
Okay.
you so much.
Great. Well, thank you. It's great to be here and also great to learn from others and to learn more about stuff from Rachel's presentation as well. So thank you. We are going to be talking about our project, which I'll get into the background in just a minute. Just an outline of where we're going. We'll talk a little bit about the impetus for this project, the aims, some of the preliminary findings, and next steps. We also wanted to, you'll see there's a lot of people here for a pilot project. And so as we describe it later, we felt like there was a lot of potential expertise, and then found that there were a number of people who really had practical expertise that we sort of serendipitously invited to be part of the team. So, for example, Christina Love on the top left is the Director of Language Access at Kennedy Krieger Institute, and met her part of the way through, and she's been a really important partner. But we just want to acknowledge that we are two of many people who have been working on this project. So in terms of the project origins, a lot of it came from, or in terms of the idea, came a bit from, in addition to research, I also practice in a community psychiatry setting. I speak Spanish. There's a relatively small Spanish-speaking population in Baltimore and fewer mental health professionals who speak Spanish. And so had been bothered by this issue where the wait list for services for Spanish-speaking patients was really disproportionately long, and unfortunately continues to be disproportionately long. And part of that is this assumption that, really they need to all go to the Spanish-speaking therapist. And so you'll see the part of the reason we ended up having a systems approach to this is because a lot of this relates to things such as like level of staffing, level of interpreters. And so, again, if you operate from the primary assumption that language might be more important than other factors. So for example, if you have a patient with really high acuity, they still need to wait for a Spanish-speaking provider versus working with an English-speaking provider with the aid of an interpreter. In my kind of anecdotal experience, I work with a lot of great providers, some of whom are hesitant to see patients with interpreters, and we'll hear a little bit about that. It's often for reasons like well-meaning reasons, right? So the feeling like they can't provide the same level of care that they provide to other patients when they have an interpreter. And so they feel, again, there's some concerns, their own ethical concerns. And then there's obviously patient and family preference. And where that comes in terms of some families and patients want to wait. It's worth it to them to be on a longer wait list. But the result of all of these, as I mentioned before, is really there can be inequitable care, particularly with respect to timeliness, but sometimes level of care and expertise as well, since the small number of bilingual providers that we have can't be trained in every single evidence-based practice. And so, as I mentioned before, we really thought about, in addition to a team-based approach, to be thinking about systems-based approach, because there's so many sort of shifting things here. And I think it was helpful for me to kind of be part of the system, and I guess as a clinician scientist, to really kind of see day to day what the challenges are in order to think about how to best approach and study them. So, this is sort of reiterating, but more in terms of like what we know about the problem generally. So those who prefer languages other than English are less likely to receive needed mental health treatment. So even controlling for level of symptoms. In an ideal world, the patients and families would be able to see a provider that speaks their language, but the reality is that there is such a shortage of there's such linguistic diversity in the population that isn't necessarily reflected in the mental health workforce. And then, as I mentioned before, right, that, adding an interpreter, it's very different in a therapy context versus potentially in in an emergency medicine setting where, or other settings where there's not so much kind of complex, their complexity related to the relationship between the patient and family and their provider. And so having, again, the effect of having this additional person, quote unquote, in the room does have potential implications. So our interest and what we've been seeking to do is really think about how can we identify team-based implementation strategies to more effectively integrate interpreters into youth mental health care team. Again, with this recognition that it's something that we really need to do if we're thinking about being able to see patients in a timely manner and, sort of when they need to be seen. And so this is just sort of the in-step conceptual model as applied to this project. I won't go too much into it because I think Christina has a lot of great outcomes to share, but really just to make sure really this middle box here is what we're hoping to be the outputs of this project. And so for our research project, our first aim was to engage community partners, and Christina will talk a little bit about who those partners were to really develop a conceptual model of how health system teams form and function to provide mental health care to youth with a language preference other than English, youth from families who have a language preference other than English. And then our second aim was to use participatory model to identify team-based implementation strategies for increasing timely access to language services or to timely access to mental health care with language. So Christina is going to take it from here.
Thank you, Rheanna. And in full transparency, I finished my slides 2 minutes before joining the meeting. So they may look good, but I'm not sure what's going to come out of my mouth. So hopefully I'm going to try to keep it on time. This is still all very preliminary. So, but we're hearing some really interesting things. So our first aim is really understanding the lay of the land, right? So what are current work processes? How are the roles currently defined? How do these teams work, right? And so we conducted 11 focus groups and interviews. As Rheanna mentioned, I think the real strength of our project is we're trying to reach everyone who touches the team in the process. So definitely the youth and their parents at the center. We also on the team are the therapist and the patient. That's who we often think of, but also then, of course, the interpreter as a member of that team. As a systems-focused project, we really thought it was essential to bring in administrators too, from both kind of the community mental health organizations and also language access services, because at the end of the day, we want something that can actually be implemented given the constraints in the system. And we know that there are many. So next slide, Rheanna. So Rheanna had put up, we basically, thank you InStep for your lovely team model. We try to adapt that for our pilot project. And if anyone is thinking about applying, the support you have in terms of if you're newer to team science is really fantastic. And so if we think back to that model, the first thing is what is the thing? What is the evidence-based intervention or practice that we are examining? And for us, it's the use of interpreters. And so without going into too much detail, a big insight was, as Rheanna had mentioned, there is a good amount of resistance from English-speaking providers to actually engage with interpreters. And this probably resonates for a lot of us. Everyone is in various stages of being overwhelmed. But for interpreters, they are, right? There is already a lot of strain. And so I highlighted this part, there is some reluctance there because it's an extra and the work is hard enough. right? And so these are some of the things in terms of understanding when and how interpreters are being pulled in that was useful for us to hear. Rheanna, next slide. This looks beautiful, like very colorful. We have done a lot of work coding our interview and focus group data, less so analyzing, but this looks pretty amazing. So basically, over the past few months, we have been doing kind of a mix of inductive and deductive codes. So our deductive codes are really following from that kind of team model that Rheanna had showed. And so we really wanted to look at team inputs, team processes, and emergent states, and look to see how they affect, our outcomes of interest. And so you can just see in this diagram, this is produced by Atlas TI, which is a qualitative analysis platform. It's called a Sankey diagram. I personally use MaxQDA usually, so I'm new to Atlas, but this is a new feature, and this is showing co-occurrence of codes. So you can see here communication and therapeutic alliance, really showing up strongly in the data as being very important. And so we're gonna dive into a little bit here today, but then maybe, I don't know, Marissa, if we come back later towards the end, we'll have more polished results later. But for today, we can share some initial insights. So Rheanna, the next slide, please. So we have not a ton of time, so I'm gonna just focus in on a few key insights. So for the team inputs, we knew that the kind of provider and the patient relationship would be pretty stable. We weren't sure going into this whether there would be some effort for continuity of the interpreter role. And because of various system constraints, there is not much continuity, right? And so there is this dynamic kind of changing of who is on the team, with the interpreter being the one really coming in anew often each time. Even if the provider and patient have been meeting many times, it's the interpreter's maybe first time being on that team, if you will. So lots of instability in that sense. In terms of the team processes, communication was huge, and that makes a lot of sense. But something that was interesting to me as a non-clinician was our therapists sharing how they even change the way they speak to patients. And so some of them shared how they may speak more directly, right, or more simply so that it can be more easily translated, but that they felt like sometimes they were being maybe too direct and less nice than they normally would be with patients when they're trying to build rapport. So just interesting in the nature of how, the therapists are speaking. It was also interesting to hear for interpreters, I mean, so much respect for all that they have to hold and communicate, not just in terms of interpreting, but also really, making the provider aware of, especially cultural context here, really came up as being huge. And so different things, meaning different things in Spanish-speaking cultures. Shared mental models in terms of emergent states. This is something that really came through as being very important, and it's of no surprise, but I think it points to a lot of interesting potential places of intervention, because we found quite simply that the interpreters, many of them, they are not specialized interpreters. They go interpret in the ED. They go interpret it for someone who just gave birth, and then they have to go over to the mental health context and interpret there. And so the training in the interpreter space is still quite informal, very much on the job, mentoring each other, but there's not a lot of formalized training, especially around how different contexts may differ, right? And on the flip side, for therapists, they may not fully appreciate and understand the role of what the interpreters are there to do, especially around that cultural context piece. So definitely some work that could be done there. Rheanna, next slide. So after we kind of did these focus groups and interviews, we ran a group model building workshop a couple of months ago. And this was bringing everyone together in person. We had 4 hours together. Everyone was in the same room. And it was incredible. I will say we had consecutive interpretation happening. And this was my first kind of workshop where that was happening. And again, respect for our colleague, Monica, who did the interpretation, to be holding so much. And it was so much enriched because of that experience. And so what was discussed here, we had heard a lot about, barriers, facilitators through the focus groups. What we really wanted to do in this workshop is come together and prioritize, which ones from all of these different perspectives are really rising to the top as ones we want to focus on. How do all of these different factors relate to one another? And then where are there potential points of intervention? So next slide. So we held this workshop here, just some snapshots. We did some dot voting on the left here. You can see we had various barriers, and then we had people kind of vote which ones were most important to them. And then on the right, we started piecing together with our partners, how these different factors may cluster and relate to one another. So just we love visualizations on our team, if you can't tell already. So next slide. So this is very drafty and very small. So we're just trying to wow you with all of our mapping, beautiful maps. Basically, this is a first draft. On Monday when we meet as a team. We're going to be starting to refine this and then share it back with our partners in a couple of months. But basically, a causal loop diagram, if it's new to anyone, it's new to both Rheanna and I. Really were excited to work together on this project because both of us had been wanting to do more in this kind of participatory system science space. And this pilot project really allowed us that chance to try this out, being guided by some very expert system scientists. But what a causal loop diagram is I'm sure many of you are used to kind of cataloging our list of barriers and facilitators, right? And so this takes it to the next step of saying, okay, how do these factors influence one another? And so you can see these kind of different causal loops, right? So what is positively affecting this variable and how does that influence other variables? So again, really starting to pull together not just what are the factors, but how are they relating and influencing one another. So next slide. So this is why we're here.
Do you want me to stop here? Or
No, you can keep going. And I'm almost done, don't worry. So we wanted to highlight 2 strategies because at the end of the day, that was what we really wanted to achieve, is to go through all of this so that we could really best identify, potential team-based implementation strategies that we could then, really try to test. And so training came up as a huge one again and again. And we always go to training, it's important for a reason. But I think especially as we were learning more about, the shared mental model around, what the mental health context looks like and an interpreter role, we're really finding that this would be valued for both roles, probably the patient too. And so just really some sort of asynchronous trainings would be very valued by all of our partners. And so, this is really this next step of how to operationalize that. Next one, Rheanna. This is one I think, again, it's a little bit of a no-brainer, but it's not being done. And this is the idea of a pre-session huddle. And so we're using the word huddle loosely, but basically a check-in before the session starts. This usually isn't done now, And so this is a quote from an interpreter, you know, she's coming in from lunch, she's going in and then going into this very heavy situation. And again, as we mentioned, these interpreters usually know nothing about why that person is there, what is their background, their preferences, what is the history here, and they're kind of going in blind. And it makes really tough, you know, to interpret in those cases. And so we've heard all around that just taking a minute, just if anyone is familiar in the surgery space, they do a timeout, right? Like a safety check, a timeout of, you know, why are we here? Like, what is some of the history here? And so really thinking through of how can we enable and implement something where it's this brief check-in so that the communication dynamics will then flow a lot more easily in the session to follow. So next slide, and then I'll wrap up. So next steps, one of our colleagues, Legia, received a small spin-off grant to really understand again how interpreters are allocated within the system. When we went into this thinking that in-person interpreters would be the most valued, something surprising that we heard is that there's actually a lot of variability from patients, whether they want an in-person interpreter. Many, especially the youth, would prefer phone or virtual because they find it strange to have someone else in the room, especially if they're new to the relationship, another grown-up staring at them. And so again, just that idea of a pre-session huddle or some way of collecting patient preferences beforehand so that they could make that known. So she has a small spin-off looking at how, you know, interpreters are allocated in the system. We'll be meeting with our partners again to share back our results. And then what we're really looking for now is, you know, where can we find more opportunities to really start co-designing, operationalizing these different strategies and testing them. So with that, I think we'll wrap up for 5 minutes if anyone has questions for either of us or Rachel. So thank you.
Thank you so much, you two. I'm equally as impressed with how much progress you both have made on this project as well. What a fantastic job. I have a brief thing I want to say, and then we'll open it up to questions as well. But you mentioned this idea of a pre-meeting huddle. That actually came up in one of our other projects, and we had a meeting with Eduardo Salas, who does a lot of like research on teamwork and team training. And he mentioned the concept of a pre-brief and the utility of a pre-brief as you know, really enhancing team effectiveness. So I'll just put that out there if you want to look into it. I believe I even listened to like a podcast that he did where he was talking about pre-brief. So maybe we can find that and send it if it's of interest.
That would be so helpful. That because we were like, what is the right naming of this? It's not
Yeah.
a pre-brief. I love that.
Yeah, I think it's well, I shouldn't speak about it. I was gonna come up with some idea of where it came from, but I won't. Fantastic. Yeah, sorry, go ahead.
It's the other thing I was gonna add, even around the like, ideally there's the huddle, but we also like some of the, even in the workshop, someone was saying, oh, actually, maybe if I put in my interpreter request, I can put more information. So even there's more written down. So they tried to do that. They're like, they're not, you know, it's not enabled for you to have enough characters to be able to do that. So again, like there's the ideally huddle beforehand, but even like some of the electronic things.
To aid in that that handoff or sort of the transition of information. Yeah. Thank you. Well, let me open it up to the room in case others have questions about either of these projects, about the pilot funding more broadly. We'd love to answer any questions you have. There was a question in the chat about the software. I just want to confirm I answered correctly that you all used Atlas TI for those coding. Okay, thank you. Well, it looks like you have your hand raised.
Great. This is for Rachel. It was an awesome presentation. I found it extremely interesting. I understand the qual works sort of all pre-analysis at this stage, but I wanted to ask if you'd sort of heard anything about like gaps in knowledge within the transition teams, for example, or I'm not really as familiar with the American system, but is it common for these transition teams to also include people from like a workplace or an institution where the student also wants to end up?
I think, thank you for the question. I think that, so it varies, things can vary a lot. I think in terms of having somebody from a specific organization like that, that does not seem to be the norm. I can't say that it would never happen, but that it would usually be more of somebody from like a department or agency who would be sort of facilitating that rather than like somebody from a particular organization or school.
Great, thanks.
I love the question. These were great talks. Thank you. It's really interesting to see, like, very different settings, but similar things that I'm running into in my own very different settings as well. Sorry about the crying toddler. But one thing I was wondering about is I think in both of these, you probably have teams, like who's really on a team and what does a team mean? And does the team extend beyond the meeting? So in the context I'm in, often like thinking about a team, people just think about like the single meeting, even though they actually do and can and could be working together outside of that meeting. So I'm curious kind of what this looks like in both these settings, like in the transition team, what are the interactions outside of the transition planning meeting? How, what are strategies to encourage that? And then same with the interpreters when you're talking about, trying to do pre-briefing or like huddles or something that extends beyond just show up in the room. And now we're instantly a team. So I'd like to hear any thoughts on that.
Rachel, would you like to go first, or do you?
Sure, I can go really quickly. Yeah, I think that that's a really good point, and I think it differs for different people on the transition team too, because some of the folks they're seeing each other every day. Like the teachers have a lot more interaction with each other. The student is there seeing the teacher. The parents are often like they might have communication more regularly, but they might not. So I think that that's a really important thing to be thinking about, and how that might differ between different team members, and then how that might impact folks' feeling of the team effectiveness if they're sort of interacting all the time, or whether they're sort of outside, feel like they're outside a little bit more. So definitely something that we should be thinking about. So thank you for that.
And I'll just say really quickly, great question, Elizabeth. Nice to see you. One thing that when we go to write this up and look to the team's literature that may be relevant is like this literature on dynamic teams, sometimes called sand dune teams, where there's like a core team and then there's a periphery. And so for us, like the core would be the therapist and the patient, and the periphery is probably more the parents and the interpreters, and kind of conceptualizing like the team around that aspect. But yeah, the interpreters are very much moving in and out, and so it is hard to call them part of the team. And I don't know, Rheanna, if you wanted to add any.
Yeah, no, I mean, it was interesting because at the workshop, and the workshop was sort of a subset from each group. It was really, there was it was the first time I think that folks had the opportunity. So we had a therapist there who uses interpreters regularly, and they were like, oh my gosh, I learned so much from them being able to reflect on this. So, there wasn't so much, I think not as much interaction outside. The other thing I will say is that I think it's really important in this case, all of the things that are not just the therapy, we wanted to kind of bound it to some degree, but recognizing that from a patient standpoint, there's a ton of different things where language comes in, and people are consistently or inconsistently used. So even the, calling and reminding, there were some, I don't remember exactly, but I know one of the quotes were around that, like, how do we remind them for the appointments? I might be hesitant to do X or Y, in part because of this.
Yeah, I think that like how do we measure all of this fluidity and churn and changes is just so important, and I have no ideas. But I did find somebody who I can talk to about it. So if I learn anything, I will share it with this group.
Thanks for your question. I know we're past the top of the hour, so I'm going to thank you all again for joining. Really fantastic job on your presentations and your projects. I am so excited to see this progress, and I look forward to even the additional work that'll happen. So thank you again, and thank you all for joining us today.
Thanks,
Take care,
all.
everybody.
Bye.